Dr. Cindy Collins, registered dietitian and health psychologist. Patients who are undergoing treatment for chemotherapy and radiation are very interested in knowing, are there supplements that I might already be taking or might want to take or read about and decide that I'd like to take that could interfere with the treatment? Could some supplements interfere with radiation and or chemotherapy? And it turns out that, for example, in the case of radiation, supplements that are very high antioxidants can actually be a problem. Now, this is something that's still being studied. It's not 100% agreed upon in the literature, but it's enough that most radiation oncologists recommend that their patients don't take high mega doses of, for example, vitamin A, vitamin C, vitamin E, also selenium, which is a mineral, and zinc, which is another mineral. Now, you can eat those in your food. That's not the issue. The issue is when you're taking massive or mega doses. And the reason being is that these antioxidants, which are very healthy for you otherwise, might be so healthy that they are in some way preventing the cancer cell from cell death. So that's the nature of antioxidants. You could look up and read about free radicals and antioxidants, and get a little more versed on this. But there's other supplements like that too. Resveratrol, I'm sure a lot of you have heard about that. And ALA, which is alpha lipoic acid, coenzyme Q10. I mean, these are the ones that are not the usual in the drugstore, but you do see these in the health food store. Those also are very high, powerful, potent antioxidants. And the problem is there's a chance that they're so good at what they do that they might block the radiation from the cancer cell, which we wouldn't want that because we would not want to hinder radiation killing or destroying those cancer cells. In the case of chemo and also immunotherapy, it gets a little more complicated. There are very specific vitamins or supplements that are contraindicated with certain chemos. And now we're learning a lot about immunotherapy, any herbs or other supplements that interfere with an area in the cell called cytochrome P450. That's like a biochemical pathway there. They can be a problem. And these are things you probably thought about taking, like chamomile, or ginkgo biloba, or maybe lycopene, bilberry, holy basil. I could go on. There's a pretty long list of these chemicals that we're now finding are healthy for other reasons for the general public, but probably not a good idea to take during chemo and radiation. And one thing I think that's important to remember is that what you did put into your body before cancer had its purpose, but while you're on treatment, you really wouldn't want to interfere with the process of the cancer treatment. And I hear a lot of patients say, but I want to also restore my body and keep it healthy otherwise. And you can do that with food. You can do that with the food and nutrients. But after treatment, you could go back to some of these supplements if you truly believe that they're giving you something that you need. Another good time to see your dietitian and discuss that with him or her. But it's also important to understand where your doctor's coming from. When these regimens for chemotherapy, for example, were studied and a protocol was made, they weren't studied with the supplements or vitamins or minerals or anything like that added to the protocol. So it's only fair to say that we can't be sure how they might hinder the chemotherapy. And you're going through a lot of treatment. You're going through, some pretty difficult treatment too. So you wouldn't want to interfere with something that could potentially save your life when you could just put aside the supplement until after treatment.